Hi, my name is Dr. Sharon Rosenberg. May is Osteoporosis Awareness Month, so I'd like to talk to you about how to keep your bones healthy. What is osteoporosis? Osteoporosis is a term that literally means porous bone. It is a skeletal disease affecting both women and men. Osteoporosis is a condition where bones have lost their minerals, especially calcium, making them weaker, more brittle, and more susceptible to fractures. Any bone in the body can be affected by osteoporosis, but the most common places to break a bone occur in the spine, the hips, and the wrist. When do we develop healthy bones? Our mothers always told us, drink your milk as a kid to make sure that your bones grow healthy. As we're still building new bone mass into our 30s, diet is crucial even as we get older. Well until our 20s and 30s, we need adequate stores of calcium, vitamin D, magnesium, and vitamin C to keep our bones strong. Why do we develop osteoporosis? As we get older, several things happen that put us at risk for this disease. Hormone levels go down, especially in women at menopause, shifting bone metabolism from bone building to bone resorption. Our bones become less efficient at actually absorbing the nutrients in our foods, so we don't get as much calcium and vitamin D out of our meals as we would like. And we're more likely to be exposed to medications such as steroids and chemotherapeutics that actually negatively affect our bones. When women reach menopause, their physicians may recommend a bone density or DEXA scan to assess how strong their bones are, depending on their risk factors. What puts you at risk for osteoporosis? Unfortunately, being a woman puts you at risk for osteoporosis, as well as age, family history, having a low body weight or a small frame, being of white, Asian, or Latino heritage, having a history of fractures due to low bone mass, menopause, inactivity, alcohol of 3 drinks or more per day, certain medications as we talked about before, and certain diseases like thyroid disease, celiac disease, inflammatory bowel disease, and other autoimmune disorders. So what can we do to help keep our bones strong as we get older? Daily calcium intake between 1,200 and 1,500 milligrams, vitamin D intake of at least 800 international units daily. We get vitamin D both from our foods and from sun, so as we get older, we may want to ask our doctors for a vitamin D level, especially if you're somebody who doesn't get a lot of sun exposure. Weight-bearing exercise at least 3 times a week helps with healthy bones. These exercises include things like brisk walking, running, and lifting weights. Now, you don't have to be Arnold Schwarzenegger. Even simple 3 to 5 pound weights can add needed stress on the bones to help them get stronger. Decreasing your alcohol consumption is a big deal. Less than 3 alcoholic beverages a day and avoiding binge drinking on the weekends will help keep your bones strong. What can you do if your doctor says you do have osteoporosis? Make sure that you get screened for secondary causes such as thyroid disease, vitamin D deficiency, and hyperparathyroidism. Continue all the preventative measures that we've talked about already. This will help slow the progression of bone loss. And discuss medical treatment with your doctor. There are several types of medication that can be prescribed to treat osteoporosis. Your doctor will be able to discuss which medicines are right for you. If you're already on osteoporosis medication, don't forget to take your calcium and vitamin D supplements. These medicines need calcium and vitamin D to do their jobs for you. And make sure you're getting yearly follow-up DEXA scans to make sure the medicine is working. Thank you for watching. If you would like to learn more about osteoporosis, I will be lecturing at St. Francis Hospital on June 9th at 6:30 p.m. as part of the Women's Health Wednesday series.